All right, good afternoon. I'm Barry Taylor, the Executive Director of the Oregon Dental Association, and I would like to welcome you to today's ODA webinar on the Oregon OSHA new respiratory standards. And I'd like to thank our new partner in infection control and in OSHA regulations, Smart Training, who is hosting today's webinar and who is presenting today's webinar. We've got a lot of questions, and yes, this seminar is being recorded, so it will be available after this. We'll put that link on our website under the COVID resources, and then in our every other Friday email that goes out about COVID, we will include the link into each one of those emails. So you shouldn't have any problem at all getting a hold of this content after today's program. Today, I would like to welcome Lee Slayton from Smart Training, who is going to do the presentation. And again, thank you to Smart Training for putting this on.
Thank you, Barry. Glad to be here. So let's get started by putting something a little more fun up on the screen than my mug. So there we go. Barry, can you see that okay?
Yeah, it looks great. That's perfect.
Okay, so I was talking to Barry before we got started today and bringing him up on a little Southern culture. If y'all haven't figured it out yet, I'm not from Oregon. The word is called lagniappe. It's a Cajun term. From Louisiana. It's spelled L-A-N-I-A-P-P-E, and it means a little something extra. So not doing a switcheroo, we're going to talk about the COVID-19 temporary rule today, but we're also going to talk about the respiratory protection program. And the reason I'm putting that in there today is dental practices have never had to deal with a respiratory protection program before the pandemic started. And there's been a lot of confusion surrounding it. And right now, my educated guess is that probably 80% of the dental practices in the US still don't have a respiratory protection program in place. And the penalties for that can be really burdensome, so much to the point that a single location dental practice in Massachusetts a couple of months ago was fined $24,000 for not having an RPP in place. And an RPP is an integral part of protecting your staff and yourself during COVID. So we're going to talk a little bit about that to start, and then we'll roll right into the COVID-19 temporary rule. So very, very briefly, what's the difference in an N95 and a K95 versus a surgical mask or a cloth mask? There is some confusion surrounding that. Cloth masks, they can help prevent the spread of COVID, but they're not considered PPE. They're intended to be used and reused. Surgical masks and N95 respirators are not. Cloth masks are easy to find. There are folks that make them at home. Surgical masks and N95s, not so much. Here's the big difference between surgical masks and N95s. Surgical masks are not considered respiratory protection. They just don't provide reliable protection from smaller airborne particles. Surgical masks are cleared for use in medical settings. And ASTM has 3 different levels of surgical masks. If you're typically in a dental practice, for folks that are doing aerosol generating procedures, they'll use a level 3. They'll use a level 1, say for periodic exams, level 2 for things that aren't aerosol generating, but they are not considered respirators. The big difference is with a surgical mask, when you're breathing in and out, that your breath is coming around the sides of the mask. Respirators should have a tight seal around your face, and you should be breathing through them, which is why you should be passing a fit test before you're using one. So that's the big difference. You're breathing through one, in and out through the respirator. You're breathing around the sides on the surgical mask. And because of that, not everyone's capable of wearing a respirator. For instance, sometimes persons with asthma can't wear a respirator. And because of that reason, that's why OSHA requires businesses to have a respiratory protection program if they have anyone on their staff that are using a respirator. So who's required to have a mandatory RPP? Anyone that has an employee who either chooses to wear one voluntarily or has to wear one because they're required to. And before let me back up just a second here, because by now, maybe some of you folks are getting writer's cramp trying to take notes. This whole PowerPoint is going to be available as a PDF for anyone who would like to have it after the presentation today. All you have to do is email me or Barry or Lauren Malone at the ODA, and we will provide this to you as a PDF. So just sit back and relax. And if you want to make notes on questions, great, but don't feel like you've got to keep up and take notes on all of this. I'll provide it all to you after the presentation today. And we're also recording this presentation. Okay, so y'all relax. Okay, so what's involved in an RPP? There are 5 basic things. It's got to be a written respiratory protection program. There has to be someone appointed that's in charge of that program. They serve as the administrator. There's got to be documented training for all the employees in the program. There has to be medical evaluations done for all personnel who will be wearing a respirator. And it doesn't matter whether they're doing it on a voluntary basis or a required basis. And then for the personnel that are required to wear a respirator, they have to undergo fit tests. So let's talk about medical evaluations for a moment. Who can perform a medical evaluation? Well, that would be any licensed healthcare professional who's this is considered within their scope of their license. Before I started the webinar today, earlier today, I was on the phone with Oregon OSHA. I was also on the phone with the Oregon Dental Board to make sure that as far as the dental board is concerned, doing a medical evaluation fell within the scope of a dentist. And in their opinion, it does. So as far as Oregon's concerned, you are good to go as a practice owner, as a dentist, on doing medical evaluations. So for a practice owner or a dentist, being able to do these medical evaluations is a good thing because it can save you money. An occupational health clinic will typically charge anywhere from $20 to $40 just to provide a medical evaluation. So if a practice owner can do that, it saves them that money. The medical evaluation is basically, there is a medical questionnaire that each user is going to fill out. And that's what the licensed healthcare professional is going to review. And then if they have any questions, they'll talk to that person that filled out that questionnaire and satisfy their question. What we recommend is that if there is something on that medical questionnaire that gives the dentist who's performing this medical evaluation pause, then what they should do is they should refer that person's medical evaluation to a physician or someone who does medical evaluations on a regular basis. But if they don't see any concerns at all, and it's pretty clear cut when you go through these questionnaires, then the healthcare professional merely signs off on that questionnaire that they are, in their opinion, they're capable of safely wearing a respirator, sign it, date it, and take that medical questionnaire and put it in the employee's confidential medical file. I mentioned confidential medical file because that medical questionnaire is considered PHI, so we have to protect it. That medical questionnaire, we've actually got it in our respiratory protection program. It's also available for download in the OSHA regs. It can be found in 29 CFR 1910-134. Again, all these numbers are going to be available to you after the webinar today. Okay, this is just kind of covering what I said. Okay, so let's talk about fit testing. Who has to do a fit test? Any user who is required to wear a respirator. So according to the CDC, in areas with moderate to substantial community transmission, during aerosol generating procedures, dental healthcare professionals should use an N95 respirator or a respirator that offers an equivalent or higher level of protection. So KN95s will work, N100s will work, and as you go up from there, you know, there are more expensive, more extensive respirators, but N95 is kind of the low bar you got to cross. You got to have at least an N95. So this has, if I had $1 for every time I've answered this question, I'd be sitting on the beach somewhere drinking one of those drinks with the little tiny umbrellas in them. We've had tons of people that have asked over the last 3 or 4 months, well, I can't get an N95 or I can't get enough N95s. Can I wear will a level 3 mask with a face shield be a substantial equivalent? The flat answer to that is no, it will not. A substantial equivalent to an N95 would be a KN95. And while we're talking about N95s or KN95s, an N95 or a KN95 with an exhale valve does not work either, because that protects the user, but not the people around them. So we're to fit test. So who can perform a fit test? Basically anyone who has been trained to perform it. We actually have a 10-minute video in our respiratory protection program on how to perform one, how to properly perform one. And there are all sorts of videos out on YouTube that will show you how to properly perform a fit test. 3M has a really, really good video on how to do that properly. The big savings can be if you do your own fit tests for your practice, but there's a rub that goes with that, and the rub is right now fit test kits are still pretty hard to source. But when practical, and part of what I mean by being practical, it depends kind of on how many people you have that are going to require a fit test. You can save a lot of money doing your fit test in-house. Fit test kits right now are running anywhere from $200 to $400 for a fit test kit. And you can perform normally about 50 to 60 fit tests with that kit. If you go to an occupational health clinic, which is your best other option, to have a fit test done. They charge anywhere from $100 to $120 per person to do a fit test. So if you've got a big office with, say 8 to 10 people, that cost can add up pretty quickly to have your fit test done at an occupational health clinic. So if you can get your hands on a fit test kit, there's a little bit of a hassle involved with doing it internally, but you can do it. There is also a way that you can create your own fit test kit. There is an OSHA appendix to the respiratory standard that actually walks you through what you've got to have to be able to conduct a fit test. It actually explains to you how you can make a hood. And of course, you have to get a couple of nebulizers and the fit test solution, either Bitrex, which is the bitter, or saccharin solution, which is the sweet, to use those. So there's a little bit more of a PITA factor to go with that. But I know of at least one specialist in Portland that constructed their own fit test kit, and it worked pretty well for them. So you've got a couple of options. You actually got 3 options there. And again, if you want to go to an occupational health clinic, you can. Some people just do it. If they don't, if four employees or less, there's less of a hassle factor just going to a occupational health clinic and having it done. It's just how much you want to spend. Okay, here's a big source of confusion. What's the difference between a fit test and a user seal check? A fit test is something that's required for each respirator user before they start using a respirator. It's got to be done initially, and then it has to be done annually thereafter. Now, this is a big source of confusion right here, which is why I've got it italicized and an asterisk next to it, because a lot of folks have the mistaken assumption. They've read somewhere about OSHA has temporarily waived fit testing requirements. Well, that's true, but they're only waiving the annual fit test requirement. Everyone still has to do the initial fit test requirement. So again, when it rolls around and a year has passed, right now the annual fit test requirement has been waived. Let me explain to you why there is an annual fit test requirement, though, so you'll understand, because hopefully this is the requirement for use of respirators is going to go away when the pandemic goes away, but we can't count on that. And at some point, if things continue, I would suspect they're going to rescind that waiver on the annual fit test requirement. The reason there's an annual fit test requirement is because things change. So let's say, I weigh 240, and let's say in January, I get really ambitious and I go on a keto diet and I get down to 205. Well, a year from now, my respirator may not fit me like it did when I had my fit test initially, because my face is probably going to be a little thinner. So it may not fit properly. Let's say, God forbid, I'm in an accident and I end up with some facial scarring, or let's say I get a broken jaw and I'm a little whopper jawed. I might not be able to pass the fit test because of that. I may have to go to a different type of respirator, a different size of respirator. So that's why you have an annual fit test, to see if anything has changed and if they might affect the way you wear a respirator. But for right now, OSHA has waived that annual fit test requirement, but not the initial fit test requirement. Okay, a user seal check. The difference between a fit check and a user seal check: a fit test you do once or once a year. A user seal check is something you should do every time you don a respirator. You do that to ensure that it's sealing around your face correctly. We've got a short video in our training module on how to properly perform a user seal check. There are other videos out on YouTube that will show you how to conduct a seal check. The long and short of it is you're basically putting your hands up against the outside of the respirator to make sure it forms a good seal around your face. Now, because we're talking about using your hands, proper donning and doffing is incredibly important to prevent cross-contamination. You've got to get in the habit of doing it the right way all the time. Okay, that's it on the respiratory protection program. Again, if you don't have one in place, you're, as my grandma used to say, your fanny is hanging out in the breeze. Don't wait until someone shows up from a regulatory authority to put one in place. It's there to protect you and your employees. It's incredibly important. Don't put it off. I'm available for questions on that after the webinar today or tomorrow. Please feel free to call me. Smart training has been around for about 25 years. Barry, I'm sorry, I'm going to get on my soapbox for just a second, but it's only to let folks know where this came from. Smart training has been doing respiratory protection plans for industrial clients for over 20 years, but most of those plans are huge and they're cumbersome. So what happened back in March, myself and another person at Smart Training, we took that huge, unwieldy program and we boiled it down to its essence to come up with something that would work for dental practices, but it was nothing more than they needed. So that we made it simple, we made it easy to implement and easy to manage. There's no, and Oregon OSHA also has a template. It's not quite as simple, but they have a template respiratory protection plan on their site as well. They've got several good resources, some of which we're going to talk about here in just a minute. But there's no excuse not to have a respiratory protection program in place to protect you, to protect your staff, and to protect your patients. So please take care of that. And again, I'm available for questions if you need some help. Okay, next we're going to talk about the COVID-19 temporary rule. If my eyes look a little crossed, well, you can't see my face right now. It's because I've been doing a lot of reading on it. This temporary rule actually took effect November 16th, although they've been working on it for a while. There are different deadlines for different aspects of the rule. And for dental practices in particular, it means there's some different requirements for dental practices than there are ordinary businesses in Oregon, because dental practices are considered exceptional risk workplaces. So really and truly, folks, y'all are on the cutting edge of this pandemic. Until we have that 30-second test where when a patient sits down in your chair and they've been tested right beforehand, there are a lot of asymptomatic folks out there, and you're closer to someone's mouth than any other healthcare professional out there, I would submit. So every procedure that you are conducting or are helping to conduct, you're dealing with somebody's saliva. So the biggest concern I've had since this all hit back in February was that there are some dental practices that do an incredibly good job with PPE. And there are others that don't. That varies from state to state, that varies from town to town. As a general rule across the country, I would say medical professionals have done a better job across the board with PPE than dental healthcare professionals. And that's a generalization there. And so my big concern, because my staff and I've done over 1,500 inspections of dental practices. So we've kind of seen it all. And PPE has always been a moving target. And by that, what I mean is you'll go in a dental practice one day and they're doing great. They're wearing all their proper PPE. Their donning and doffing procedures are letter perfect. And let's say you go into an oral surgery practice on a Friday and it's lunchtime and they're an hour behind because they had 3 emergencies. They had to work in there and stuff's flying everywhere. And the PPE situation is probably a little suboptimal sometimes. And I'm not picking on oral surgeons there. I'm just saying sometimes in the dental world, PPE, the way we use it, has not always been at the highest level consistently. And so my concern has been that, and from what I've seen, or the places I've been in since March, in the dental world, people have really upped their game. They've done a much more consistent job with doing the proper donning and doffing that they should, washing your hands like religiously, doing all the things we know we're supposed to do, and they're doing it consistently. But along with that comes some fatigue. I unfortunately had to spend 5 days in the hospital back in August. I was in a major metropolitan hospital in Dallas. Because of that, I got to talk to a lot of different healthcare professionals. And the one piece of feedback that I received from them that really struck home with me was the mental fatigue that comes with knowing that I've got to do everything right each time, donning and doffing. I've got to do everything right because the chance of infection is much, much higher. So that's been the big concern, and that's why we've just been preaching from the mountaintops about proper PPE, proper donning and doffing every time, correct every time. Okay, I'm going to get off my soapbox. We'll move on. So here are here are the requirements for all workplaces. And I'm sure y'all are familiar with these. We're going to go through them pretty quickly. Physical distancing. Employers must ensure that work activities and workflow are designed to eliminate the need for any employee to be within, there's a typo, sorry, 6 feet of another to fulfill their job duties, unless the employer determines and can demonstrate that physical distancing is not feasible. Oh gosh, there's another. Sorry. So in the dental world, that's tough. But in the dental world, we're already garbed up anyway. So the folks at OSHA realize that, but because that's so important, it's just another reason why the donning and doffing and the masks and washing your hands is all the more important, because in a lot of our work in a dental practice, it's just not possible to stay 6 feet apart. Okay, masks, face coverings, or face shield requirements. All individuals, including employees, patients, vendors, must wear a mask, face covering, or face shield. So let's talk about that face shield for a minute. Because it says mask, face covering, or face shield. So someone can wear just a face shield and meet the rule. However, it's not the best. And OSHA, Oregon OSHA strongly recommends that individuals wear a mask or a face covering as source control. Don't rely on a face shield alone. If someone physically can't wear a mask or a face covering, then go with a face shield. But boy, let's discourage that as much as we can. And of course, the last one on this page, employer must provide mask, face coverings, or face shields for employees at no cost. You know, we've already got that covered and have had for years. So we don't need to dwell on that. Cleaning and sanitation, it's kind of the same way. You know, in the dental world, we've been doing this, you know, from day one. Regularly cleaning or sanitizing all common areas, shared equipment, high-touch surfaces. And that's at least once every 24 hours, or if you're working over a 12-hour shift, you've got to do it at least once every 8 hours. Now, where in reality, where this may come into play for your practice might be that now you're wiping down some high-touch surfaces that maybe you weren't before. In other words, maybe you were doing a just bang up great job on prepping those operatories and making sure everything's wiped down in sterilization, but maybe some of those doorknobs and high-touch surfaces in waiting areas left a little to be desired, or maybe in break rooms left a little to be desired. This is where folks really need to step up. So cleaning and sanitation, you know, what is it? What's the old saw? Cleanliness is next to godliness. So, okay, posting requirements. There is a COVID-19 hazards poster that must be posted in a conspicuous manner in a central location where workers can be expected to see it. And that's also available on Oregon OSHA's website. Ventilation requirements. So if you're a practice owner, you need to know that by January 6th of next year, you must optimize the amount of air, outside air circulated through your existing HVAC system, so that the air quality index remains at either good or moderate levels. This does not require installation of new ventilation equipment, but you should probably check with your HVAC repair person or where you got your system and make sure that it's going to meet that requirement. Backing up just a second, this temporary rule is available to download from the Oregon OSHA site. It's actually pretty simple reading. It's, oh gosh, about 18 pages, but that's in big, bold, you know, 10-point type, pretty simple reading. I've tried to dumb it down as much as I can today and not give you every word, but I would advise everybody to jump in, take a look at it for clarification's sake. Okay, so let's talk about some things that are required for dental practices. So there is a written exposure risk assessment that has to be done no later than December 7th. Oregon OSHA, again, they have a risk assessment template and a sample available to help you with this task. It's pretty simple. You can't just, now, when I say simple, that doesn't mean you can buzz through this thing in 5 minutes. And so, you know, we can't go that deep in the 1 hour today, but it's a written risk assessment. You can download it off of their website, and you and some of your staff can go through it because it's not a one person answers at all. Go through it and either write it up, or they've got it where you can type it up. to complete that. And you've got to have that done by December 7th. There is a requirement for a written infection control plan. Again, by December 7th, all employers must establish and implement an infection control plan based on the risks identified in 3G. Again, they've got the template and they've got a sample available to assist employers with that task. We are adding both of these items to our OSHA compliance offering as well, but Oregon OSHA does have that available. Okay, there is a COVID-19 infection notification process as well. You've got to establish a process to notify exposed employees. And that's defined as those who are within 6 feet of a confirmed COVID-19 individual for a cumulative total of 15 minutes or more. There is a form that has been published by Oregon OSHA on their website. Again, we're going to provide links to all these that you can download and put the name of your practice there, and that will satisfy that requirement by adopting that model procedure. So I'm not gonna dwell on this a whole lot. COVID-19 testing for workers. Employer must cooperate by making its employees an appropriate space available at no cost to the workers when a local public health agency or the OHA indicate that diagnostic testing within your workplace is necessary. If it's conducted at the employer's direction, then the employer is responsible for covering the cost of testing and the employee time and employee travel. If the employer is not requesting the test, then they are not expected to cover those direct costs of testing nor the cost of the employee travel. When an employee participates in quarantining or isolation, the employer must allow the affected employee to work at home if suitable work is available and the employee's condition doesn't prevent it. That's probably not going to happen very often in a dental practice unless it's someone that's working, let's say a non-clinical employee. I would say that is probably going to be rare. And if they do participate in quarantine or isolation, the infected worker must be entitled to return to the previous job duties if still available and without any adverse action as a result of participation in the quarantine. Okay. Employee information and training. This is another requirement for dental practices. So no later than December 21st, about a month from now, employers must provide workers with information and training regarding COVID-19. So smart training, we are putting together a training, online training course now, along with the ODA, to meet that requirement, and we'll be providing it free to all members of the ODA and their staffs. We've started working on it now. Realistically, we're probably a couple of weeks away from having that ready. As soon as it is ready, there will be an email going out from the ODA with a link to be able to sign up for that free online. There will also be a the infection control plan between this training and another piece of training we have. We have a right now. Smart Training has an infection control training module that's an hour and a half long. Between these two modules, the new one that's going to be created for COVID-19 and the current hour and a half infection control training module, that will meet your 2-hour every 2 years requirement for CE. So just want to let y'all know that will be available Both of those courses will be available free of charge to any member of the ODA and their staff. And that will meet your 2-hour CE requirement on infection control. Okay, PPE. Well, I feel like we've beaten it to death, but let's talk about it a little more. Face shields, goggles, gloves, masks, or respirators. You know, what you're wearing is going to depend in part on your type of procedure and in part on your patient disposition. If it's an aerosol generating procedure, you're always going to use a respirator. It doesn't matter whether it's someone that you suspect of having COVID or of not. And if it's a patient that shows evidence or is suspected of having COVID, you're going to use that respirator for all procedures. Now, you know, there are some practices out there that are choosing to go ahead and wear a respirator for every procedure. And if you can procure the number of respirators you need, that's really the best way to go. But as far as the letter of the law, with the amount of community transmission in Oregon right now, if it's aerosol generating and you use a respirator. If you're doing a prophy, or if you're doing something with, you know, high speed, you definitely want to be using a respirator. If it's something simple, if you're doing an exam, no. But if the patient shows evidence or suspected of having COVID-19, you want to be using a respirator all the time. And that's assuming you're wanting to treat them, or they need to be treated at the time. Obviously, the best thing is if someone's got COVID, if it's a non-emergent, if you can reschedule that patient for later, everyone is better served. Okay, so we're going to open it up to questions now. Let's see. And okay, I've got 3 questions so far. So folks, let your fingers fly on that keyboard. So first question, what if your whole team doesn't want to use a respirator? They choose to wear level 3s and face shields. So, you know, if you don't want to use a respirator, you can do that, but you're playing with fire. You're potentially jeopardizing your team members' health. You're jeopardizing people's licenses to be able to earn a living, and you're jeopardizing the reputation of the office, and you're jeopardizing that practice owner's ability to make a living and what they might pay in fines. It's just a so what if your whole team doesn't want to wear a respirator? So let's just for clarification's purpose, let's say that whole team, we're talking about clinical employees. Clinical employees, we just went over it. If you're doing an aerosol generating procedure, you got to have a respirator on. And as a practice owner, if you're letting your employees not wear a respirator, then shame on you. A level 3 mask and a face shield won't cut it. Now, it looks like this question might have come in before we got to that point in the webinar, so I'm probably beating a dead horse. Second question says, should, does that mean not must? When I read should in regulations, now I come from a regulatory background. We are in the business of keeping our clients out of trouble. So we are, how do I say this? We are in the belt and suspenders. That's kind of how we look at things. We're belt and suspenders. We're in the risk management business. So when I read should, to me, that does mean must. Okay. And if you'd like to talk to me after the webinar, I'm available by phone, and just know I'm 2 hours ahead of you. What are we supposed to do if an employee cannot pass a fit test, cannot find an N95 that fits? Wow, that's a great question. I've had this happen a couple of times. So there are a couple of different things you can do. So I'm assuming this employee is going to be around aerosol generating procedures. Two potential things. Can they switch job assignments so that they're in a job that doesn't require that they wear a respirator, or look at trying a different respirator? And the first thing I would recommend is contact your dental supply company rep and tell them your problem and say, I need to find a couple of different types of respirators to see what works. You can also contact an occupational health clinic to see if they have any suggestions there. The next step up would be you go to a respirator that's a little more higher end. So I know of several dentists who are using, I'm hoping I'm pronouncing this right, PAPRs, the purified air. Oh, flitter! I forgot the what the acronym stands for. But basically, you're wearing a full face respirator and it's pumping air into it. I know of several staffs that have done that. And those do not require a fit test. So they are not inexpensive, but you don't have to change them out either. So I've seen them, they're typically in the $1,200 or so range. Not inexpensive, but again, you don't have to get a fit test, and you don't have to replace those. You can clean them and reuse them. Okay, there is a limit to what kind of respirators we have access to. I am not clear on how a fit test helps if we don't have any, many options. Okay. So if you're sticking with the same type of respirator, it's the style of respirator that you're getting a fit test with. So if you're getting a KN95 and you've been getting the same style KN95 and it fits, then that fit test will work for continuing to use that style. So it's the style. So if you're flipping from an N95 to a KN95 because of supply problems, that's where you've got a problem, because the fit test is looking at a particular model of respirator. So there are a couple of different styles of N95s, for instance. Some are the form-fitting, in other words, they're semi-rigid, and others are not. But tell you what, Ann, if you'll give me a ring after we get through, I'll see if I can go into that a little farther, okay? So Jacob has a question about what about extended use measures? What I would tell you to do, the one thing I didn't do this morning, and I apologize, was do a little polling of how acquisition of PPE is right now in Oregon. But extended use measures, this COVID-19 rule really doesn't address that, other than they're taking you back to the OHA and the different tiers as far as reusing N95s. And things are kind of all over the place on that. So I apologize, but I'm not going to go real deep there because I may end up sticking my foot in my mouth. But I would go back to the OHA. They've got different tiers based on what you can do based on how available respirator supplies are right now in your area. Okay. I hope I got close to answering that one, Jacob. Okay, what if I have two hygienists who do not want to wear respirators, but they do not use the ultrasonic scaler? They do rinse the patient with the air water syringe. Am I at risk? I don't think so. An air water syringe, my first question would be, are you using a dam or something like an isolite? And are you using suction? Are you doing four-handed dentistry? Now, I know with hygiene, you don't always do that, but these are extraordinary times. I think you're going to be okay with that. And if you'll reach out to me after the webinar is over, I'll get that answered for you. Good question. Well, we're getting some great questions here today. Okay. We had a gentleman from Oregon OSHA that said only offices with 11 or more employees have to have a written plan. Yes, he was wrong, because you're in an exceptional risk category. So yes, I'm looking at the matrix right now on the written program, and it covers, he is correct, he is partially correct. It covers employers with 10 or more employees, but you're also falling under the exceptional risk workplace. So yes, you got to do it. Okay. What is the longest you can keep an N95 mask to use before throwing it away? Wow, great question. This is going to sound very Clinton-esque, but I guess my answer would be, it depends. I don't know what your situation is with acquiring PPE right now, with acquiring respirators. Okay, here we go. What is the longest you can keep an N95 mask to use before throwing it away? All right. Yes, I'm gonna jump down this other one really quick. Looks like the session ended before the links to some of the help, like the respiratory plan, were given out. Is it possible to get them by email? Yes. Let me give you all my email address, and of course Barry's got it as well. It's Lee, L-E-E, Slayton, S as in Sam, L-A-T-O-N, at Smart Training, that's all one word, and it has two T's in it, .com. Now, let me give you an even better source, and that's my senior compliance advisor up in Portland. Her name is Cindy, C-I-N-D-Y, Hull, H-U-L-L. Cindy is a practicing hygienist, has been for over 30 years. At her practice, she was also the OSHA lead for 20 plus years. And Cindy has forgotten more about infection control than I've probably ever learned. So when it comes to clinical issues, Cindy is a pro. And so I would direct you to reach out to Cindy as well. So her email address is Cindy Hull, CindyHull at smarttraining.com. And of course, this will be available if folks want to listen to it again. This will be made available out on the ODA website. Okay. And you know what? I'm going to pass the buck to Cindy as far as the longest you can keep an N95 mask to use before throwing it away, because she's on the ground in Oregon and can answer that much more intelligently than a slow talking guy from Dallas, Texas. All right. And the question about the two hygienists, I'm gonna have Cindy. I'm gonna direct that one to Cindy as well. And so if y'all would direct those two to Cindy, that would be awesome. Let's see if we've got any other questions. That is it. Barry, can you hear me okay?
Yes, I can.
Okay. All right. So it's 4:03. Well, I'm sorry. It's 2:03 Oregon time. I'll stay as long as we've got questions that I think I can answer. If not, I'd say let's give it about another 60 seconds for somebody that's types slow like I do. And if not, we will wrap it up for today. Again, Cindy and I are both available by phone, again, for clinical questions, especially relating to ones that are on the ground there in Oregon. Cindy is going to be your go-to person. She, you know, as far as regs go, as far as just, you know, she's been in the trenches for 30 years. She's been a real asset for Smart Training since we were lucky enough to steal her away from a dental practice a few years ago. So, Barry, I'd say let's go ahead and wrap it up. And this will be made available. The links to the documents that we were talking about that Oregon OSHA provides, we'll be providing those links as well. And again, if anyone wants to email me to actually get a PDF of the slide presentation today, I'll be happy to provide it. Barry will be sending out an email as soon as that training module is available. And again, it's going to be available free to all ODA members and their staff. The hour-and-a-half long infection control module that we already have on Smart Training's site, we are also going to offer that free of charge, so that between those two modules, you can get your infection control training requirement out for the next 2 years. So,
Dean, thank you very much for your presentation today in Smart Training. We appreciate everything you're doing to help us.
Thank you, Barry. It's my pleasure. We're happy to be working with you. We've been in Oregon now for about 5 years, and we're really tickled to be supporting the ODA in an even bigger way now. So everyone, have a good day. Stay safe during Thanksgiving. Don't, it's a trite phrase, but don't let your foot off the gas. We've got a little ways to go here before we can get out of this mess. So everyone, be safe, be smart, and let us know how we can serve you. Thank you very much. Y'all have a great day.